We disconnected for a second. We're back. All right. How's everybody doing? It is Thursday. We're into the first week of July. Well, actually, yeah, right after the holiday. What are we at? July 8th. July 8th, 2021. For those of you who don't know us, welcome. We actually want to thank you a lot for taking your time. Your most valuable resource, to be honest. I mean, it is the thing you cannot get back. You can't even buy it back. Is your time. So, thank you for joining us. My name is Chris, physical therapist, EHS Physical Therapy Chiropractic. Your herniated, disc expert right here with you,
right.
with my main man, Jake.
Yeah, hello, Jake. I'm a chiropractor at East Central Motion Spine and Sport.
So we get this, we deal with this kind of thing often, which is good. It's what we, truly enjoy, and brighten it up a little bit. We truly enjoy helping people understand, low back, neck, disc issues. We helping guiding you through the, the pitfalls, the myths of the things that you hear or you see on the internet or from
Social
other
media,
providers.
yeah.
So, running's bad for you, or why are you doing deadlifts and squats? It's terrible for you. You're only going to hurt yourself. Those are myths. Those aren't true. That's not true in any sense of the way. But today I want to talk about the consequences and the true costs of low back pain, or just disc in general. It could be the neck as well. And where did you want to start with this one, Jakey?
Yeah, we can just talk about some of the different options. So, we have chiropractic, we have physical therapy, we have going to your medical doctor, we have injections, we've got surgery, under surgery we got fusions, we got microdiscectomies,
Laminectomies, different kinds of things.
Oh, radio frequency ablation.
Yep.
I mean, there's tons of different options out there for you for low back pain, but I guess we feel strongly that there should be a progression or a starting point, and then if that doesn't work, then you move on to the other things.
Mm-hmm. And that's because, we've talked about this before, there is no standard in care for mechanical low back pain,
Yeah.
Which there needs to be. It's just that there's so many providers and they all do it so differently that it's hard to create an actual, standardized treatment plan for that.
Yeah.
But of course, on the conservative side, the side that we're on, it's not only less costly, right, money-wise,
much less.
but it's also less costly with the potential side effects, things that you do to your body that you can't take back, like a surgery or certain, injecting things, or when you start changing, the chemistry and the actual structure of the body, you can't, go back and say, well, that didn't work. Let's just go ahead and take that cage and all those screws and nuts and bolts out of there. That's not how it works. It's once it's done, it's done.
And the lower cost allows us to see you more frequently, which allows us to
and
better
really get to know you
and get to
right?
know
I
you,
mean, yeah.
create a therapeutic alliance, create that relationship, and we can better evaluate from day to day, week to week, month to month,
and
how you're
to help
changing, how you're
guide you,
feeling.
so you build trust, build a relationship, so you're feeling like, okay, I know what these guys or gals, what they're about, how they're going to help me, rather than a 7 to 10 minute visit with a doctor or a primary care provider, head down in their notes, writing you a prescription. Here's a pill. Try this for a few weeks. If not, we'll get you an advanced image, and then just all they're going to do is refer you on to some kind of specialist for either injections or surgery.
That's what drives the cost
the
up.
most, yeah. And significantly, we're talking
Thousands.
An MD visit. You go to them 3-4 times before they even refer you on to something else, because now you're on medications for a few weeks, which you've wasted now potentially 2 to 3 weeks of healing time doing the right things just by taking medication and hoping your body just heals with time. That's $250 to $300 per visit when you go to see them. An MRI is about $2,000. A steroid injection is about $1,200 per shot, right? So $1,200 to $1,500 per shot.
And a lot of those aren't, especially those shots, they offer a window of temporary relief, and then you're back to where you were.
Right, and that's if and we talked about this on a previous one. If it's chemical pain,
if
it's chemically mediated, it could be pretty helpful. And sometimes we will actually advise you to go get those if that's going to be helpful. But at least let someone subclassify that pain into, is it chemical, is it mechanical? I was just talking with someone on a different group recently. I said, hey, I got my injection. Didn't do anything. Didn't help. Anybody else have this experience? And people are saying yes. Well, it's because the vast majority of low back pain is mechanical. And if you get a chemical solution, it's a round round peg in a square hole. It doesn't do all that much. That is a very good point. And then if you keep going down that path, so now you're adding up. A couple visits. Okay, so let's say 4 visits at $250. There's $1,000. another 2,000 on an MRI just to tell you what you already know is happening. Something's wrong with your back.
And at this point, we're moving towards a more chronic pain, which is longer-lasting pain, which is harder to change.
Mm-hmm.
If we can get the right intervention early on from the beginning, addressing the mechanical cause, we can make quicker changes that are longer-lasting and prevent that spiraling down this endless path of
it also increases
things that don't work.
Increases your fear
Yeah.
and your confusion about what's going on, because now you're seeing these big scary words. You're searching on Google and you're like, okay, I'm scared. I don't know what to do. I'm confused. They're telling me I might have to have surgery. They're telling me I have to go get these injections. I have to have these nerves burned off, and you're like, whoa, what can I just what's going on? And that's kind of where I was going with the consequences of back pain. So it's not just the pain. You got to think deeper, the layers. Consequence 1, consequence 2, consequence 3, right? So it starts with 1, right? So pain, it hurts. Okay, what does that do? Well, it doesn't allow me to sit or move comfortably. It doesn't allow me to do certain things. And then what happens that? Well, now now I'm not sleeping well, right? So now I'm more irritable because it hurts and I don't sleep. Consequence, so that's the second level, right? What about the third level? Well, because I'm not sleeping well and it hurts, now I'm more tired. Now I'm moving even less.
Now I'm unhappy.
Now I'm happy. It's affecting my home life, my relationships with my family,
life.
with work relationships. Okay, that's level 3, right? Now, and so I'm just making these up as I go.
Yeah, these are good.
Your story could be different, but this is very similar or very common what we see, right? Level 4. All right. So now because I'm more irritable, I'm more tired. The back hurts. My relationships are suffering. Now I'm missing things that I like. Now I'm missing workouts. I'm missing activities because I can't. Not only am I more tired, but I'm trying to get things done, and this, the pain's hurting me.
Depression, anxiety.
Yep. And then level 5, the next level down. Okay, now the fear starts to set in.
Yep.
Like, wait, is this ever going to go away? Like, am I ever going to get to the bottom of this? What is going on? I start looking up things on Dr. Google, and that makes me even more scared. And then it just spirals down. And then now all of a sudden, the next level 6. Now you're spending. Now we get to this part where we're spending money. We go to the emergency room, and we go to get an MD. Or just a regular doctor visit that they're just going to send you on to a specialist anyway, or give you medications, order unnecessary tests, and you might fall down all the way down that spiral, all the way down that hole into a $30,000 back surgery.
And that might not even
possibly could have been avoided. Yeah, possibly could have been avoided with let's say 8 to 10 sessions with a combination of physical therapy and chiropractic interventions and teaching you how to move, how to help yourself, how to take control of it, how to gain confidence, how to get back to, fitness and lifting and getting strong and really squashing a lot of those myths that you can't do this and you shouldn't do that and never lift more than 20 pounds. Because now your whole life has changed. Now you're saying, well, man, my whole life is different and I can't do anything anymore. And then you fall into the chronic pain and the feel sorry for yourself type fears. That's like, well, I was told to never do this and I can't ever do that, and don't you know that I have all these problems and I'm broke and I can never do these things?
Then you latch onto and that's a whole different story. So
think of how many layers deep that goes just from the starting point of, hey, my low back's sore. And that's how it starts typically. My low back hurts, or my neck hurts, my shoulder blade hurts.
And then the leg pain, then the arm pain, then you're like, okay, now I should go get checked.
So the total costs and consequences are much deeper and run much further than just getting, when that starts happening and you're like, what, it's not going away, something's not quite right. Let's go in, let's have a consultation, let's see what's going on with someone who understands mechanical pain, understands the spine, understands
back, what we do all day long.
That's what we do.
Yeah. And so we talked about it, we hit on it a little bit. We would be the lowest expense or lowest cost treatment that you can get into, and probably the quickest treatment you can get into.
So we're not going to make you wait 2 weeks to see a specialist.
You'll get in
same day or the next day.
Yeah. And then I just looked up some quick,
which is just as fast as an ER for the most part, and we're going to actually do something for you. I know a lot of you don't want to go to the ER because it's not an emergency. I mean, it hurts, but it's like, where do I go? What am I supposed to do? All they're going to do is just pump me full of medication and send me home because they don't know what to do with your pain.
So we're not just going to give you treatment, but we're going to give you a plan. Which that's the key difference probably from our model compared to some of the other models is we will come up with a plan to get you back to whatever you're trying to get back to.
Yep.
And we will constantly reassess and reevaluate as we see you in our visits.
And it will be more than what you might be used to, a standard, pop, crack, see you tomorrow, and it's also going to be more than the garbage. cookbook PT that you've been to where, okay, go hop on a bike for 15 minutes, go lay on the table, I'll stretch your hamstring for a couple times, here's a hot pack, here's some e-stim and some ultrasound, and just go ahead and do these 10, here's a packet of 10 exercises that everybody gets that comes through the door. I hope and pray that one of them actually helps you. I don't know if it will because we don't know what we're doing here. We just give everybody these exercises. That's the other thing that, that we don't do that you don't want is that kind of garbage physical therapy that you see all over the place, especially in the big, the corporate, the ones that come into town. In our town, it's going to be your ATIs, your Athleticos, the ones that come in and have clinics everywhere, and they just hire whoever's around to fill the spot, and they give everybody the same thing, and that's kind of what they do.
Cookie cutter approach.
Yeah, and it's different on the chiropractic side. We don't have any like corporate big people that come in and have multiple clinics. Yeah. So yeah, any kind of like on my side, the hospital systems, the big places that have multiple clinics, that's pretty much what you're going to get. You'll probably see a different person every time. You got to explain your story again and again every time. They'll have their head down in a computer typing, or you're just a chart. You're just a number on a chart. And I don't think, for the most part, most of you want that. You want a solution. You want the relationship. You want someone you can grow with as you get older and other things come up, so that you can get back to, whatever it is, fitness, lifting weights,
sports,
running,
taking care of kids, whatever. And so just quick couple numbers I threw out there. So I looked up the average chiropractic visit, $65. Average PT visit, you said, is what, around
around 100,
$7,500. So I mean, that's very affordable, as compared to the other options you have. So I think starting with chiropractic
in a natural, safe way.
Oh yeah. So I think if you can start with chiropractor or PT and branch out from there, I think that's your best approach, because we should be able to handle, I don't know, a good 95%.
Play the odds.
Yeah, 95%.
It's probably going to be all right. We're probably going to get it figured out for you with a good speed, as well as a cost-effective way to fix this problem. And we just wanted to go over some of the consequences and costs of disc, spine, pain, and injury. And I think it's pretty clear to us that there are right ways and there are not so right ways to do it. I mean, we're trying to break those patterns. I mean, the standard way, of course, is that people, for the most part, if you don't know what you don't know, you just go to the primary care like you normally would, and you just follow what they say. But you don't have.
You don't have to start there.
We are in an age of information where the information and the people that can help you are out there somewhere. They don't even have to be in your city. They could be somewhere. But with social media, and you can private message somebody
you can instantly contact anybody. Yeah.
So if you're not sure, even if you can kind of feel like, I don't know if this is right for me. I don't know if, giving me medications, is the right thing, or I really don't want to have surgery. I want to try something a little bit different first, and that's the only thing that they're suggesting. Then
get a second opinion.
Look something up. Go somewhere else. Ask 8, 10
There's
people
options.
that you know.
Yeah.
All right.
So, if we can be a resource for any of you in any way, feel free to send us a message, ask us a question. We're always happy to provide information. We'll do videos. We'll answer your questions. Reach out. Thanks, guys.
Thank you. See you guys later.